Hello everyone, welcome back to sqadia.com, best video learning platform all over the world. Today, the topic we are going to discuss is antipsychotic drugs. Schizophrenia is a mental disorder characterized by specific psychological manifestations. These include auditory hallucinations, delusions, thought disorders, and behavioral disturbances. Recent evidence suggests that schizophrenia is caused by developmental abnormalities involving mainly the cerebral cortex. Schizophrenia involves both genetic and environmental factors. More than 20 potential susceptibility genes have been identified, but no single gene is responsible. Neuroleptic drugs control many of the symptoms of schizophrenia. They have most effect on the positive symptoms, such as hallucinations and delusion. Negative symptoms, such as cognitive impairment, social withdrawal, and emotional apathy, are less affected by neuroleptic drugs. Up to 30% of patients show no improvement even with prolonged treatment. The neuroleptics are all antagonists at D2 dopamine receptors, suggesting that schizophrenia is associated with increased activity in the dopaminergic mesolimbic and mesocortical pathway. In agreement with this idea, amphetamine, which causes dopamine release, can produce a psychotic state in normal subjects. Recent experiments using single photon emission, computed tomography, have shown that schizophrenics, there is greater occupancy of D2 receptors, implying greater dopaminergic stimulation. Neuroleptic drugs require several weeks to control the symptoms of schizophrenia, and most patients will require maintenance treatment for many years. Relapses are common even in drug-maintained patients, and more than 2/3 of patients relapse within 1 year if they stop drug treatment. Unfortunately, neuroleptics also block dopamine receptors in the basal ganglia, and this frequently results in distressing and disabling extrapyramidal side effects. These include Parkinsonism, acute dystonic reactions, which may require treatment with antimuscarinic drugs, akathisia, motor restlessness, and tardive dyskinesia, orofacial and trunk movements, which are usually irreversible. It is not known what causes tardive dyskinesia. It is possible that chronic block of inhibitory D2 receptors in the striatum leads to an increased release of glutamate and excitotoxic degeneration. Some antipsychotics are atypical in that they are free or relatively free of EPSEs and may reduce the negative symptoms of schizophrenia. In the pituitary gland, dopamine acting on D2 dopamine receptors inhibits prolactin release. This effect is blocked by most neuroleptics, and the resulting increase in prolactin release often causes endocrine side effects. Many neuroleptics have muscarinic receptor and alpha-adrenoceptor blocking actions and cause autonomic side effects, including postural hypotension, dry mouth, and constipation. The potency of individual drugs in blocking autonomic receptors, and therefore their predominant peripheral side effects, depends on the chemical class to which they belong. Blockade of central H1 receptors is responsible for sedative effects of neuroleptics. Up to 1% of patients using antipsychotics develop neuroleptic malignant syndrome, a rare but potentially fatal idiosyncratic reaction that involves hyperthermia and muscle rigidity. Antipsychotic therapy is stopped immediately, but there is no proven effective treatment.